Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone, and welcome to another episode of Entrepreneurship in Healthcare. I'm so excited to have next to me virtually Dr. Randie Schacter. And before we started recording, I just wanted to verify how to say her name, and she said Schacter like tractor. So I just have to repeat that because it's funny. Do you do that a lot in life?
Absolutely, because a lot of people say Shatner, and then I'll say, "I wish,"
Right.
because,
You'd be
like, yeah, who
inheriting a
wouldn't wanna
lot,
be related to William Shatner,
of
right?
course. What if they say it just because it's the first thing they can think of with the
I don't
beginning of your
know.
like,
Yeah,
right? Okay,
right,
interesting. Because I mean, it's clearly spelled Schacter, so
right.
I think it's funny that people make up words. Okay. All right. Dr. Schacter,
Yeah.
tell us a little bit about you before we go on to the question of the hour.
Well, what do you wanna know? Like, where do you wanna
Yeah,
start?
good
There's so
question. Because
many
we're good.
things.
We want to know about you, succinctly about you as, let's first do you as a doctor.
Alright, so I'm a psychiatrist. I treat women and children. I've had a private practice in a town called Matthews, which is right outside the city of Charlotte, but in the county of Mecklenburg, which is still kinda Charlotte-ish. um, since 2010, May 2010, so just a little holiday anniversary. And I love practicing psychiatry. I love treating people. Can't say I love the prior auths or any of that stuff, but the people could do it all the time. And I am solo practice. I have like a office person that helps me. I have student interns that come in and learn a little. Then it helps them with a reference, and I pay my interns. I don't believe people should work for free. Um, and they rotate through, and then they either go to med school or become psychologists or sociologists or whatever, and that kind of works.
Okay, fantastic. So
Mhm.
we are going to move forward to the question of the hour. Entrepreneurship in healthcare. Is it good or bad?
Necessary.
Wow, that is the most succinct answer we've ever had. And different than good or bad. So obviously necessary means it's good. Can
Correct.
you expound on that a bit? Tell us, why do
Sure.
you think that it's necessary? And do you
Well,
think that, that the curriculum nowadays integrate it has this integrated into it?
so I think it's necessary because my father was a doctor. I worked in his office. And so I grew up in medicine. And I have watched the trajectory of medicine over time and the loss of autonomy if you are not an entrepreneur in medicine. I have watched my colleagues feel that they are strangulated by corporate medicine. I am not. Other than prior auths, I am not, because I am an entrepreneur in medicine. Whereas those that have not learned those skills and do not understand the system the same way that I do, or ignore the things that I do not have to pay attention to, um, I'm in a different ballgame. Whereas where my father, when he was in that system, there was autonomy. There was this belief that the doctor had the first right of refusal and decision-making process, and then the insurance companies kind of followed, as opposed to some high school graduate on a telephone that is giving a protocol that's listed, that was created by an internist telling a psychiatrist how to practice medicine when it really, they don't understand the subtle nuances of this very complicated person because one study showed this in some way to our. It's not like that.
Yeah, so well said. I especially really love the fact that you have medicine flowing through your veins, so to speak. And so you have grown up with medicine in the past, right? So you were
Yeah. I
there
mean, I worked in
for,
my dad's office as a kid.
wow.
Yeah, totally.
Can you give us some historical, some extent
Sure. I think
examples?
that when I was little, right, in the billing, how it worked was that the patient could check whether the doctor got the money first or the patient got the money first from insurance. And then they either paid at the time of the visit if the patient wanted to be reimbursed, or the doctor would wait and get the money. There was no copay. You were either paid the fee or the insurance paid the fee. And it was really kind of an agreement that was made. And so sometimes there was a mistake and the patient would pay the doctor and then the doctor would get the check. And my dad would be like, but you already paid me, so I'm holding on to your check. And when you get here, I'll give it back. And I mean, it was just a much more honest, simpler.
Yeah, the transactions sounded like they were occurring at the location where the service was being rendered,
Correct.
which
Right.
is really the way that entrepreneurship should work ideally without the creep of all of those middlemen inside. And what
Yep.
that does is it makes it transactional, it makes it nebulous, it makes it uber confusing. And
Right.
between you and I know that everybody agrees with this, purposefully so.
Oh, 100%.
Right.
I mean, I've
Purposefully so.
definitely read articles, and who knows if they're real or not real, about people that have read that it was intentionally nebulous and purposeful. The harder it is for us to understand and break it apart, the easier it is for them to have control.
Exactly, because at the end of the day, you're also always hearing stories about people that just push and fight and finally, get their way because they were right all along. But, clearly these middlemen are putting up barriers just to stop us from fighting. In fact, I saw a reel recently and there's no way I'm going to find it, but I saw a very clever oh, you know what it was? It was a South Park episode about healthcare. And it was true in so many ways. I know South Park is very sort of insulting to many people, but it really was on
I,
point. And in it, the guy was saying, like, I'm just going to hope that you don't do anything. And if you push and push and push, you might win at the end, but most people don't. And so we win, something of
right.
like of that
Oh,
nature.
100%.
I find it fitting to show you a little snippet from that South Park episode that I mentioned. Credit goes to two urban girls from Instagram and the South Park franchise.
No, we're not here to give you money. We're here to file a claim for my friend's medication.
Oh, you want money from us? Right through that door over there. The medical director's job is just to say no.
Look, my friend's mom has been paying you people for years, and his doctor says his weight is a medical concern and obesity is a disease. Oprah Winfrey said so.
Okay, calm down, calm down. I didn't realize I was dealing with someone who had so much determination. If you do a little more work, I think we can get your medications paid for.
What, we can?
Yeah, you see, the doctors and the pharmaceutical companies and the insurance companies all kind of work together. So all you have to do is navigate the American healthcare system.
They deny initially, hoping that you don't pursue, and then they keep it. And even if you do, that little bit of interest that they collect is in their coffers. So, and that's how they win a little at a time. The
It's
other piece that I always teach my patients is that if you've really hit a barrier and you know that you're correct, then you need to contact your state insurance commissioner. And very often, once that does happen, it gets fixed.
Oh, you mean for your specific case?
Every state has a state insurance commissioner. So let's say you are having trouble get something reimbursed or having a prior auth go through that really is appropriate. And for whatever reason, your insurance company is being very difficult. You can go to the state insurance commissioner and file a complaint that your insurance is inappropriately handling the case. And then the insurance commissioner will contact that insurance company. And more often than not, when that happens, that insurance company will say, I'm sorry, let me take a look at this again and we'll see what we can do. Because if our legislature does not know what our insurance companies are doing, they will continue to run rampant. An example is last year, Vyvanse decided that they were not going to be a #1 tier after years of telling us that they were going to be, and it became 4th tier. And so all of these patients that we had been coaxed along to, you must prescribe this because Adderall is not covered anymore, and Midas and all these other amphetamines are not allowed anymore. And then they just blanketly made it 4th tier, and now everybody had to pay $400, or you must change them or jump through 10 hoops. And so I called the state society and said, this is ridiculous. You got to help us. And they said, oh, I don't know. Nobody said anything. I'm like, well, then ask everybody. And so they asked, and they were like, yeah, we're having that problem. I'm having that problem. So they went to Blue Cross Blue Shield and said, what is this? And they said, oh, well, if a doctor says that they feel it's medical necessary, and just send us a letter, we'll undo it. If you're a psychiatrist, and I said, that's not enough. I said, do you think the pediatricians need to go through all these hoops too? You need to tell them it needs to be for any of us. It shouldn't just have to be me. Pediatricians shouldn't have to do it for their 2,000 and I only have 500. That's like crazy. And so then I learned that it wasn't just my state. 2 years ago, they did it in another state. They just kind of do it in little states, hope nobody notices, and that they'll get away with it. And then they don't have to pay for Vyvanse. People pay out of pocket. The insurance company doesn't. It's gross.
It is. That was my reaction when you first said it. And I was going to say, this is really gross.
Right.
Really, it really is. For those of you listening, it's just so yucky. I think I was going to say the word yucky rather than gross.
Yeah.
Especially since, again, I mean, at the end of the day, these are helpless humans that are, just trying to get care. And a lot of times they're sick and they don't have bandwidth. And by the way, you have to sit and you have to like press buttons and you have to wait and the operator and this and that. I feel like they just get away short of murder. I mean, obviously they're not, well, they're criminal. They're just not murderers, but really a lot of just behavior that's yucky. I think that's such a like good way to describe it in simple terms. How do we change this?
I think people need to make noise. I think people need to contact their insurance commissioner when they see that something's wrong and it's really not okay. Like if you've been on a medicine forever and they say, no, you need to try 4 different ones before I'll let you go back on that medicine, and you know that this one works and you've tried 5 before this, that's like, above all, do no harm. I made an oath that I was not going to harm someone, and now you are telling me that I need to potentially harm them because you don't want to cover this, and they're paying $2,600 a month to insure their family, and you're not going to give them the medicine that they need.
We'll be right back. Our Neurodiversity Conference is a conference about people who think differently. Take a listen to our lineup.
Hey, it's Crystal, and I am so excited to be chairing this conference for and about neurodiverse physicians. We're going to talk about some of the different neurodiversities and how they can or potentially can impact your treatment plan.
My presentation will be on sleep strategies for neurodivergent physicians. We'll talk about how the unique gifts and challenges affect sleep.
And I'm excited to share about mindfulness, how to quiet the chatter in your mind and feel more calm and present.
Having a different brain predisposes you to problems and changes some of our novel treatments. In my lecture, you'll learn what those treatment options are, how they differ in people with neurodiversity, and how we can differentiate burnout from actual psychiatric illness.
Whether you have ADHD or not, you can join my class to learn how to optimize your executive function and end procrastination loops.
There are a lot of people out there who are on the spectrum but don't know it. They know they're different, but they don't understand why. And that's what I'm going to be discussing with you.
It's important to remember that this concept of normal or neurotypical is not a value judgment. It's just the most common type of brain, so that's the kind of brain that society is structured around.
To better recognize and support your colleagues who may have ADHD, and that includes yourself as well as perhaps people that you're leading if you're a physician leader.
You can catch this event live for free or access the footage after it's over anytime by purchasing a ticket on our website at doctorsonsocialmedia.com/conferences. Now back to the show.
I made an oath that I was not going to harm someone, and now you are telling me that I need to potentially harm them because you don't want to cover this, and they're paying $2,600 a month to insure their family, and you're not going to give them the medicine that they need. Oh, and the best. So now you do this prior auth. You've spent 3 hours typing your letter, being on hold, doing whatever. And guess how much the money costs if you do GoodRx or something? $30 a month.
Yeah.
But
I
so
hear
you've
that all
just
the time.
wasted $700, $800 of your day for a $30 a month thing that the insurance company could just cover.
Right. It
Sometimes
actually
it's not. Sometimes they're very expensive, but it's wrong.
It is. And a lot of times I hear that the cost per out of pocket is much more affordable than actually going through the insurance, which is ironic and it's also unexpected, right? We just
Right.
do it almost like a knee-jerk reflex. And then in the end, it would have cost less if we didn't do all the work. But it actually reminds me of a story, a headline, a news headline that happened, I don't know, maybe a year or two ago. And I don't know the very exact details. So don't quote me on this, but you can certainly look it up, where a young woman had a seizure disorder and needed like a seizure medication and went to see her doctor. I don't know if it was actually a doctor or a mid-level practitioner. So whoever it was the person that was providing care. And of course, they prescribed the seizure medication that she needed. But when she got to the pharmacy, it turned out that her insurance denied it. Now, the pharmacist says that they then contacted the doctor. And of course, like time passes by between all of this. So it's not like it happens immediately. But basically, bottom line, she couldn't get the medication because of the insurance. The pharmacist claims that they tried to reach the doctor for a prior auth. The doctor or whoever it was claims that they did not get contacted by the pharmacist.
Right.
Bottom line is that this young woman did not go on her medication because she was denied that medication, and she passed away. And she passed away, and her family then went on to sue, but didn't sue the insurance company because, of course, the insurance company is protected, because why wouldn't they be? And you cannot sue them. Instead, it was the pharmacist and the doctor or the provider, whoever it was, that was sued. So think about that for a second. Even if you're listening and you're not a doctor, even if you're listening and you are a patient, okay? Put yourself in the shoes of a hardworking doctor that prescribed the medication that would have saved her life. And that when she leaves that door, she goes and does her thing and then is being told no by the party, the third party that's the middleman, right? It is a middleman here because that,
Right.
and they have said no to her. But the doctor then gets sued and is responsible. So did you hear about that case?
I haven't, but that's not the first case.
Of course.
I mean, I have, so psychiatry, eating disorders, right? I mean, getting coverage for eating disorder is really, really difficult and extremely expensive, but it's probably one of the most deadly diseases in psychiatry that somebody can have. And so, I mean, there was a great article in Medscape, like maybe 6 months, a year ago, where a doctor wrote about how she felt so much loss and grief after one of her patients died from insurance neglect, basically.
Terrible, terrible. We'll be right back. Hey everyone, Donna Corriel from SoMeDocs. SoMeDocs has just newly released its Side Ventures series. It joins a stellar lineup of other fabulous video and podcast series, including Entrepreneurship in Healthcare, SoMeDocs Conversations, and more. In fact, we're working with our members to create more interesting and unique shows to share with you. But if you're interested in Side Ventures, we do also have a Facebook group that's been built just for doctors that are curious on what else. Check out the Facebook groups that we manage at doctorsonsocialmedia.com/our-facebook-groups. I'll see you there. Back to our show. So let's talk about entrepreneurship for a second now that we've made this an entrepreneurship episode. So is it private practice that can help us to sort of carry out our entrepreneurial mindset and become entrepreneurs? Or are there other ways that you can be an entrepreneur as a physician and be better at what you do?
I think it depends on the human. It depends on how risk averse they are. It depends on what they want, right? So I am happy being a solo practitioner and having the autonomy of not being responsible for a large staff, not being responsible of covering for other people when they go away, and then having to worry about them covering for me as far as patient in-house care. Like I have a call group in town. We're all individual solo practice. And if I'm going away for a week, I'll send an email and I'll be like, hey, is anyone around? Will you cover my days? And yes. And then the reverse happens. And then we rotate every weekend and there's like 11 of us. And so like 1 in 11 weekends, I may get a phone call from a patient who is having a hard time and needs somebody to talk to, or ran out of medicine and needs, coverage until that doctor comes back. And it's very well managed. The doctors are good doctors in town. It's really a nice group.
So you're working through a call share.
Correct.
Okay, great. And is that happening on a regular basis, or do you take call for your own patients when you're around and not on vacation?
Yeah, I'm available to my patients 24/7. But
that's really nice.
My patients are respectful, and it's not like I get calls all night long every day. They know the office hours, and if it's something that's not urgent, they will leave a voicemail. And
I keep
when
hearing
I get
that.
back,
I keep hearing that from private practice doctors. Also, with all of these movements towards DPC and concierge medicine, there's a lot of feedback on this, and doctors that are practicing it are saying that even those that share their personal cell phone numbers with patients will be surprised and really won't have those numbers abused, because patients really do. They're patients, they're human beings, and they
all my
understand
patients
that.
have my cell phone.
That's so
They
wonderful.
wouldn't want to be called in the middle of the night at 2 a.m. So why would they want to call me at that hour unless they really needed me? And if they really need me, then my job is to be there, right?
That's beautiful. Really, that's really beautiful.
Yeah.
But what happens when somebody does potentially abuse it and sort of cross that barrier that you've made, that unspoken rule?
So then you train them.
Okay, love that.
And then there's also guidelines and policies that they sign. And if they are abusive significantly, then there's the ability to end the relationship, right? And then there's also the ability to charge.
This came up in our recent Private Practice 101 conference and the discussion that we had in the Facebook group. The topic of boundaries came up and how we establish them as doctors of private practices. And I really think that Dr. Schacter hits the nail on the head here with a possible solution. Let's pause for a quick break. Private Practice 101 is the latest in virtual conferences you can access on our site.
I'm going to talk to you about lease negotiations and purchase negotiations.
I'll talk about how to prepare, plan, and organize your personal finances when you are starting out on your own private practice.
We're going to talk about how to apply this information to detect and prevent fraud.
This talk is for doctors who are fed up with the overregulation of patient care.
And I'm excited to teach you the ins and outs of how to build a thriving referral network and Facebook group.
And how to build in compliance efforts and strengthen your negotiation tactics. Because I want you to make money and I want you to stay safe.
I'm really looking forward to talking with you about creating and retaining a high-functioning team.
About the psychological and emotional things that undoubtedly come up as you reach certain barriers.
Marketing yourself as a professional in the world of today.
Form a virtual corporation and use your practice skills in a virtual environment that allows you to thrive without having to worry about managing overhead, managing a staff, or even managing a building.
Top mistakes in credentialing and those key metrics you're going to want to monitor in order to increase your revenue in your practice.
How to overcome your fear and move from your medical practice now into a private practice.
I'll share 3 distinct skills that when you use them, you can create and maintain a long-lasting, passionate marriage while becoming a very successful practice owner.
My talk called Creating a Vision and Applying It to Build Your Practice is going to help you streamline your process and create the practice of your dreams.
Stop trading the value you provide to patients for cost.
I'm going to teach you how to learn your value and your worth, how it is you get paid and what you actually cost, and how to train your sniffometer and know when to leave.
Access this valuable resource at doctorsonsocialmedia.com/conferences. Now back to the show.
And then there's also the ability to charge. So typically, if somebody calls me between visits and it's a simple question, or they have an issue and it's medically relevant and it's appropriate that I want them to call me, I'm not charging. But if they're calling between visits and they want to have a visit 5 times between visits and it's 20, 30 minutes, well, my son and I'm not sure, and what do you think? Then I will charge. And once I start charging for those visits stop happening as often. And I start saying, why don't we just schedule more often? And then we don't have to have these, and that's another way. So you can, and you remind them, this is really a visit conversation. Why don't we table it?
I cannot even begin to tell you how simplistic that is and how beautiful it is too. Like, it just makes sense. And the reason I'm saying this is because I was a practicing internist where calls were never reimbursed, right? Like, you can be called in the middle of the night, and sometimes you can also be called just in the regular afternoon by people that just knew that the doctor was going to answer the call service and that they were going to get the doctor. And they didn't have to pay
like a CNA.
Exactly. And it can sometimes, interestingly, it can be abused, but I love that when you're in charge, now we're talking entrepreneurial, mindset, but when you're in charge, you can actually place rules on this interaction and say, you know what, that's appropriate versus, this is my 4th or 5th call with you. And at this point, like, you either come to my office or I have to charge you for a televisit.
Correct.
That's great. Yeah. Do you think it's easier for you to do that because you're a psychiatrist versus like an internist, or do you think that all of this applies?
I think anyone. I mean, if you make those your rules, those are your rules. My rules actually say that any phone call can be charged in 10-minute increments. I just choose not to, because I think, like, if it's a relevant, appropriate call, I want them to call me. If they're having a rash and I just started them on Lamictal,
of course,
I don't want them to be afraid to call me because they're going to get charged for that 10-minute phone call. I want that call. Right?
That's really great. I really love that. I want to let the audience know that what's relevant here is that Dr. Randie Schacter, first of all, that we're having a private practice conference this weekend, but you may be watching this or listening to this after the fact, and you can still access that private practice conference. But even more pertinent to Dr. Schacter is that she's going to be a speaker in our lineup in a conference about neurodiversity and about doctors that think differently. Can you tell us about what you're going to be lecturing about?
Sure. So I'm going to lecture about how to meditate and use mindfulness, and a little bit about the difference between formal and informal practice, because everybody uses the word mindfulness and how to be mindful, and there's like different nuances between the two. And then how to recognize that there's horses of different colors, right? I don't know if you watched the Oz and the Wizard of Oz, and it was like the Emerald City, but then every once in a while it kind of changes color, and then everybody seems a little different, right? And so if you didn't like the Emerald City, it could be the Golden City, and then everything looked different and felt different. And so with meditation, there are different ways of meditating. And if so, emerald was not your color, and staring at a wall and just focusing at one thing doesn't work for you, well, then let's do an open focused meditation. Let's try a movement meditation. There are so many different ways to meditate and be mindful that if your brain doesn't work this way, then let's figure out a way for your brain to kind of be present and in the moment that way. And so through different practice, you can find a practice that helps calm all the chatter and that overwhelm and bring it down a little bit so that you can kind of do what you need to do once the charge is not so overcharged.
Oh, I so love that. I love that because I myself am so not like I'm such an out of the box thinker. And I so dislike when people say it has to be a certain way. And again, I get it where it comes to like algorithms that have been long researched and you're sort of doing something to make sure that you're not causing someone harm. But at the same time, I really value creativity and imagination and not being like a cookie cutter and really just giving attention to our unique selves. So, so that really hits home. And thank you for that. I'm so excited about this neurodiversity conference. Dr. Crystal Sodatis is actually the chair of that. So shout out to her.
Absolutely. Lovely woman.
Yeah, she's wonderful. And I actually grabbed Dr. Schacter's official 40-something second preview that sits on our landing page, and here it is.
Hi, my name is Dr. Randie Schacter, and I'm excited to share about mindfulness, how to quiet the chatter in your mind and feel more calm and present. We'll go over the science behind it, how to practice it in a formal manner, and how to use it informally in your day-to-day, how to find a practice that suits you. We're all different, so finding the way that works best for you makes it more easy to use. It's fun, it's easy, it's doable. Practice makes practice. No one's perfect, neither is this, but it works.
We're going to cover the following on a different episode because I initially was going to film this with Dr. Schacter and talk about her side ventures of so interesting, like your pottery and your trips to Portugal. I want you to promise us that you will come back and you will, awesome, you'll record a side ventures episode and we will get to talk about your pottery and about your travel to
100%.
Portugal.
I would be
Okay,
happy to.
awesome. I love it. Before we leave, is there any specific ask that you want to share with our audience?
So one of the things that two things. One is that if you're a doctor and you are a successful entrepreneur, that you pay it forward. Or so like for me, I go back to where I did my residency and I teach residents how to open a private practice because I was not taught that. And when I was a resident, I basically knew that eventually that is what I wanted to do. And every supervisor that had a private practice, I collected all of their forms and how did you bill and what did you do? Well, all of my colleagues were more like, what medication side effects? And I did all that too. But on top of it, it was, how do you run at this? How do you do this? Because my dad did it one way, but it wasn't the only way. And I wanted everyone's version. And when I went and started my practice, my progress notes is literally a meld of like 20 different supervisors' notes. My intakes are the same, I just kind of took what I wanted from each to create. And so I go back and I teach. And so I think that really needs to happen, that the people, your mentors, you need to become that mentor for the next group because they need to be prepared for what's out there. It's much more difficult than it was for us. And I think that someone needs to change before people die in droves, or there's none of us and no one's going to take care of us.
Wow, I really appreciate that. That was number one, and you were going to do two
The
things.
second one is that our legislature doesn't hear anything that we have to say or that our patients have to say unless we actually go and tell them. They only hear what pharma says and insurance companies say because they have a huge pockets for lobbyists. So when you think something is wrong, just call them, send them an email, anything. If you think something's unethically happening in any situation, whether it's a prior auth that happened, an insurance company problem, whether they can get sued or not isn't always the issue. It's whether they can get their hands tied and policies changed because they're doing something. So maybe on the golf course, they can be told, you're not allowed to do that anymore.
Right.
But if, you know, senators and House of Representatives out there, they have really great insurance. And once they are done, it's for life. So they have no clue what we're going through because they get it nicey nice.
Why doesn't that change? I wonder why they shouldn't have to sort of have the same insurances that the regular people have.
I don't know, but they should walk in our shoes for just,
right.
I don't know, a couple months, get those bills, see what it's like to have to get a declined prior auth.
Right. That's really frustrating. All right. I don't think that our, little episode is going to make a change, but I'm hoping that people that are listening will at least be inspired to, contact their legislators and maybe make more noise.
Right.
Yeah. And also,
definitely.
listen, like that's part of why, first of all, these series happen to have these conversations, but also why I publish in our magazine and I circulate everything so that when there are stories that need to be circulated, we can do that and we can get some more coverage for, just the bad things that are happening behind the scenes, drawing back the curtain, so to speak.
Yeah.
All right. Well, thank you so much for joining. And we will definitely, it sounds like you made a promise to come back for the Side Ventures show.
Absolutely.
Perfect. All right. Bye, everybody. Thanks so much for listening.